What are bloodborne pathogens? They are infectious materials in human blood and bodily fluids that can cause disease in humans. Exposure can result in serious illness or death, so that's why it's important to know how to protect yourselves, okay? Who's at risk? Anyone who comes in contact with human blood or bodily fluids, and anyone who touches potentially contaminated surfaces or equipment. So we'll get into the details of that. Ooh. So potentially infectious sources of bloodborne pathogens are blood, bodily fluids containing visible blood, semen and vaginal secretions, or torn or loose skin. So you cannot get bloodborne pathogens from these bodily fluids. You cannot get bloodborne pathogens from feces, urine, tears, saliva, vomit, sputum, or sweat. That's not to say you can't catch other illnesses from these things, but you cannot catch bloodborne pathogens unless they contain visible blood, okay? The special education area is higher risk for exposure. That's because special ed children are more prone to injury, they're more likely to have special medical needs, and some of them are dependent on adults for their personal care. Accidental injury is the most common thing that you guys are going to come in contact with that could expose you to these pathogens. So injury from broken glass, sharp metal, needles, knives, orthodontic wires, that's a common one, especially in the elementary and middle school age kids. So how do the pathogens enter your body? If you, just by touching blood with your intact skin, they can't enter. But if you have any open cuts or nicks, skin abrasions, dermatitis, acne, or if you touch blood to your mucous membranes of your eyes, nose, or mouth. Standard precautions means we treat all blood and bodily fluids as potentially infectious. You can't look at somebody and tell if they have a bloodborne pathogen in their body, okay? You can't look at somebody and tell that they have hepatitis B or HIV. Many people with these infections have no knowledge or symptoms of their disease. So how do you reduce your risk of exposure? Use personal protective equipment, or PPE. We use gloves, masks, gowns, face shields, and protective eyewear if necessary. Use engineering controls, proper housekeeping, and the hepatitis B vaccine can protect you. So choosing the appropriate PPE, depending on your risk level. You want to use gloves anytime you come in contact with blood or other bodily fluids, or you might come in contact with it. Mask and eye protection are if there's a chance of splashing blood into your mouth, nose, or eyes, and gowns for risk of splattering or spilling on your clothes or skin. That's more geared towards healthcare professionals. Hopefully you guys aren't going to be cleaning up large quantities of blood that are going to be dripping, but hopefully. Engineering controls are devices that reduce employee risk by isolating and removing the hazard. So these are sharps containers, safety medical devices, and biosafety cabinets. Work practice controls are things that you can do using proper hand washing. You can get the hepatitis B vaccine, proper handling of sharps and needles, so that means making sure that it gets into a sharps container, proper disposal of infectious waste, and wearing the appropriate PPE. That's wearing your gloves. Hand washing is the single most important means of preventing the spread of infection. That's any infection, not just bloodborne pathogens. Okay, wash your hands well. And if you need to know how to wash them, you can look at my nice little diagram there. When to wash your hands. Before and after touching someone or something potentially infectious, after you remove your gloves, so even if you wore gloves, you still need to wash your hands after you take them off. After handling potentially infectious material, after using the bathroom, and before eating, smoking, applying cosmetics, and handling contact lenses. Biohazard waste disposal. You want to discard contaminated sharps in approved sharps containers, discard all other infectious materials in red biohazard trash bags. These are picked up by the biohazard waste technicians and they are incinerated. And that's the symbol that the bags would have on them. Housekeeping or cleaning up after spills of blood or cleaning contaminated surfaces. You want to disinfect equipment and services with approved disinfectant. So that's dispatch, Sandy wipes, or 10% bleach solution. It's more about cleaning up. You want to wear gloves when you're cleaning up, absorb the spill with paper towels if it's still wet, spray it and leave a bleach solution on it for 10 minutes, and then dispose of all your cleaning materials and PPE in a biohazard trash bag. So the most common bloodborne pathogens that we worry about in the United States would be hepatitis B virus, hepatitis C virus, and HIV. Hepatitis B, and just to go through each of these briefly, is an infection of the liver. It can lead to cirrhosis, liver cancer, and death. There's a 20% risk of infection if you come in contact with a contaminated sharp. And the virus can survive in dried blood for up to 7 days. So that's important. If you're going to be cleaning up anything that's dried, just because it's dry doesn't mean you can't catch something from it. So you always want to use your gloves. Symptoms of hepatitis B are fatigue, loss of appetite, nausea, jaundice, which is a yellowing of your skin and eyes, fever, abdominal pain, joint pain, and 30% of people with hepatitis B have no symptoms for a period of time. It is preventable with vaccine. The vaccine is recommended for all high-risk groups. It is considered to be safe, and there's a 3-shot series over a 6-month period, which provides lifelong immunity to Hep B. Hepatitis C is the most common chronic bloodborne infection in the U.S. It causes liver damage, cirrhosis, and liver cancer, and it's the leading reason for liver transplants in the U.S. There's a 2% risk of infection by coming in contact with a contaminated sharp. The symptoms are the same as with Hep B. Symptoms may occur within 2 weeks to many years later. So 85% of people that have the virus don't know that they're infected. There is no vaccine for hepatitis C. There are some new treatments that are expensive and have lengthy courses, but they are available. HIV attacks the body's immune system, causing it to be unable to fight off other infections, and there's no vaccine or cure for HIV. Again, there are treatments, but no cure available. Initially, someone with HIV has mild flu-like symptoms, such as fever and swollen glands, but they may be free of symptoms for months to many years, and it eventually leads to AIDS and death. This is just your risk of contracting HIV if you're exposed to bodily fluids. A little bit less than with Hep B and Hep C, but. So what if you're exposed? What do? Wash your hands with soap and water, number 1. If blood or bodily fluids splash into your mucous membranes, like your eyes, nose, or mouth, you want to rinse those areas for 15 minutes continuously. That sounds like a long time, but if you get a splash, you're going to want to rinse it for longer than that, okay? Have the source of infection remain available, so whoever's blood splashed into your mucous membranes, you want to keep them available because they'll need to be tested. Who needs to know? You want to contact your school nurse and your administrator to let them know. There's forms that need to be filled out if you are contaminated or exposed. You'll follow your school's policy, and most importantly, just seek medical care. Either me or your primary provider, whoever you want to go to, so they'll assess your risk and do whatever testing needs to be done, okay?